Hi, I'm Melissa Mosier, and I'm going to attempt to do this video. I'm going to show you how I arrive a patient in labor and delivery and hook them up on the fetal monitor and kind of what to do when they're admitted. So they wheel up in a wheelchair and we wheel them in labor and delivery. We ask them to please get changed into a gown and give a urine sample in a cup. Then we ask them to get into the bed. So they get into the bed, and we have straps here. This goes around the mother's belly. I take the monitors. This is for contractions, and this is for fetal heart tones. This monitor, which is all tangled up and somebody tied it in a knot. I don't know who did this. This is going to take 5 minutes to get this untangled. We plug in the monitor called the ultrasound Toco. You put gel on the monitor, and when the patient's in bed, you put this on their belly. It monitors the fetal heart tones. This monitor is called a Toco. And you plug it in here, no gel, and you put it on the mother's stomach with these two belts, and this monitors contractions. After the patient's in bed, I get blood pressure cuff and hook it up. Now the patient is on the fetal monitor. I've made sure I'm getting the fetal heart tones. That reassured me that the baby is on the monitor, and we do indeed have heart tones. Hook up the blood pressure cuff. Put the blood pressure cuff on the mother. Push the start button. And I get a temperature. It's a forehead temperature. Then I start out, I usually have a stethoscope on my neck, and I do a head-to-toe assessment on my patient. And we receive any pregnant patient in labor and delivery that's 18 weeks and up. After I have them on the monitor, I've taken their vitals, and I do an assessment, I do a sterile vag exam. I open the drawer, and I use gel and a glove. I put the glove on, put the gel on, and I go around to the other side of the bed because I'm right-handed, and I do a sterile vag exam. That determines if their cervix is dilated, and we need to know that to determine whether they're in preterm labor or labor. How many minutes am I at?
You're at 3 minutes right now.
Okay, I'm at 3 minutes. All right, so after they're on the monitor, I have their vitals, and I've done a vag exam on them. I come over here to the monitor. We have a computer system called Epic. So I log in. I've already arrived them in the Epic computer system. I have to wait for Epic to come on. It takes a while. This patient today, we're going to say that she is 27 weeks pregnant in 2 days, and she came in and complained of nausea and vomiting. This is her second pregnancy, and her first baby's a year old. She denies any other complications with the pregnancy. So I'm in the computer. So I pull her up on Epic, and then we have a navigator. So I start with the navigator, and I go down through here, and I ask her questions. Arrival, chief complaint, her OB doctor, date that she's due, her OB history is how many times she's been pregnant, medical history, psychosocial history, allergies, patient profile, fetal heart tones, contractions, her membranes, are they ruptured or they're not, and what medications does she take, and stuff like that. After I have filled all this out, I do my physical assessment on the computer. I ask her any other concerns because I need to call the doctor. So then I say I will get back with you after I call the physician on call. I leave her, if they're a C-section, I don't give them ice water. If they're vaginal delivery in the past, they are allowed to have ice water. We fill up the ice water, give them ice water, and she waits for me to get back with her after I call the doctor on call. And that's it. Typically, we keep a patient 2 hours and rule them out. The doctor may order PO hydration or lab work, and that's it. And I chart every 15 minutes on the heart tones. Thank you.